It is time for our nursing tip of the week, and in this week's tip, we are talking about a more sensitive subject of how to terminally extubate a patient. The words terminally extubate kind of just don't really sit well with me. So I prefer like compassionate extubation or comfort care, but nonetheless, they all mean the same thing of taking a patient off life support and allowing them to naturally pass away. As an ICU nurse, this is probably one of the most common ways I see patients pass away is by the patient and or family deciding like, hey, this is not going to progress to any sort of meaningful quality of life. The patient wouldn't want this. Let's make them comfortable and take them off life support and allow them to naturally pass. So I want to talk about a couple little things that I do or say when I go ahead and terminally extubate someone. First things first, make sure everybody's on board with the terminal extubation, meaning that the patient, if they are able to be involved, is making that decision, or their next of kin, medical power of attorney, is making that decision, and the provider, like everybody should be on the same page that this is what is happening. Next, you're going to want to make sure you have orders for pain medication and anti-anxiety medication, and sometimes you can get medication orders like glycopyrrolate for secretions. I always like to tell the families like, hey, the ball's in your court. I'm here when you guys are ready. Take your time, but you let me know when you are ready for us to take the breathing tube out. I like for families to feel like they're kind of in control of the situation because they're very much not so in control of the majority of the situation. So the things that I can kind of involve them in, I always like to let them be involved. Once they are ready, I will call my respiratory therapist, who is actually the person that's going to be taking the breathing tube out, and I will gather all of my medications that I'm going to be giving the patient prior to removing the breathing tube. I like to give medications prior to the breathing tube coming out because I like to tell the families like, hey, I'm giving them some pain medication. That way, when we remove the tube, they're already comfortable. And if they need more, there's no limit on what we can give for comfort care patients. So like, please, I'm going to be looking out for if the patient appears to be in distress or uncomfortable. But if you think they're in distress, you know them best, and please let me know. We'll suction the patient's mouth out. We will go ahead and give those medications, turn off all of the drips if they have any drips running, and then we'll go ahead and take the breathing tube out. I always like to ask families, like, do you want to stay for this? Do you want to step out? Because it can be a little bit yucky or lots of secretions. And then I'll monitor the patient. I'll make sure they stay comfortable. I'll be there to support the families. I will make sure, if they want a chaplain there, that the chaplain's there. But yeah, it can be a very peaceful thing in a sad moment. But let me know if you have any more questions on this. I'm happy to elaborate more. And that's your tip of the week.